All right.
Yeah, we're good.
Great. Thank you, Renee. Good evening, everyone. This is the meeting of the East Longmeadow Board of Health on Tuesday, April 23rd. And I'm going to call this meeting to order. And we are meeting tonight on a Zoom webinar pursuant to former Governor Baker suspending certain provisions of the open meeting law effective March 2020, which was extended by Governor Healy. And those are the call to order and the chair announcements. So the first thing on our agenda tonight is to approve the minutes of the previous meeting. Ladies, did you get a chance to look at the minutes of the last meeting?
Yeah, I move as written for approval.
I had one edit,
Oh.
where it says like the meeting was closed, it still says 6 p.m. So if we could just change that to the meeting was closed at 7.
Oh, I totally missed that.
Absolutely.
So I'm going to move that we accept the minutes with the slight change to have the end time of the meeting be registered at 7 p.m.
I second.
All right. And a roll call vote. Christine Johnston, aye. Dr. Katie Jobbins.
Aye.
And Rebecca Torsha.
Aye.
All right. So minutes are approved with that one slight change. Next on our agenda tonight is public comment. Renee, can you look and see if anyone's here for public comment?
I believe Mr. Christensen is in attendance. If he has any comment or wants to be promoted to a panelist, if you want to raise your hand. Okay, buddy. Hold on one second. All right. He's on his way in. Ta-da.
Hi, Tom. Welcome.
Hi, thank you so much. I'm sorry. I got to start with I'm sorry it's taken me this long to get onto a meeting. Yeah, I just wanted to pop in and say hi and let you know that I appreciate all that you do. And I'd say if you need anything, call me, but I work in the same space as your staff, so I know you won't need any help from me. But I just wanted to say hi and thanks, and sorry it's taken me so long to come on. I have bumped into Christine around town. I haven't had the pleasure meeting everyone else, but
Tom, we had Easter together.
We did.
Yeah. At Twin Hills.
Oh. Where's my memory?
It's okay.
They serve mimosas there. It's not my fault.
When he says bumped into me, we all took our kids mini golfing at the same time.
The same.
Yeah.
It all counts.
It's a small town.
It is very nice to be able to have your ear readily available on most days that we can catch you in the office. Whether it's just to verify that we're all doing the right thing or just to get a good kind of sounding board for some of the stuff. So we do appreciate that. And you've been very supportive of us.
Well, thank you. Like I said, I appreciate all that you do, and I'm just here to hang out. So please go about your business, and appreciate y'all.
There's no one else as an attendee, so.
All right. Thanks,
Hi,
Renee.
Renee.
Tom, thank you
Hi,
so
Tom.
much for joining us. All right. With that, Tammy, the floor is yours to go over business at hand.
Okay, I'm going to make letter A, sorry. I'm going to explain it in like the least painful way possible for us to understand, because honestly, it took me a while to kind of wrap my brain around it when Tom first came to me, when Will Arment, is that how you say it? Will Arment from Arment Trucking in Deer Park, asked about whether or not we had a technical fee for site assignment for a waste disposal facility. In this case, it's a construction and demolition debris. We call it C&D. That's the acronym for it. That's going in on Deer Park. It's gotten through planning, And their next step now is they are applying for site assignment to the DEP, Department of Environmental Protection. And it's going to take quite a few months. From what I had a nice talk with kind of like our regional liaison with DEP, and it could take about 6 or 7 months for them to go through the whole review of all their documents. So in the meantime, while they're applying, they will also be submitting all of that information, copies of all the materials, which I've seen it before in the past. We're talking a nice big binder. They have to submit it to the Board of Health. Eventually, after DEP has approved their application, we're going to have to review that information, make a decision, and then we will write up what's called a site assignment document. I sent you guys links to 310 CMR 16, which is the site assignment regulations for solid waste facilities. And I think I just abbreviated it as well as I could. So when we do make our decision and we're going to put out that document, we will have to have a public hearing about it. I don't have any information that would sway us one way or the other right now. I just have the basic information that they brought into the planning department, which anybody can get on our website because they've done a good job in downloading all the documents. But there's really not much environmental impact in that right now. So that's the kind of things that we'll be getting. And so Tom pointed out to me that if we're going to assess a technical assessment fee, because of how we have to have it in our bylaws, we'll need to also have it, if we approve a fee, we'll have to put it up for town council. So my suggestion based off of what I've seen before is that it would be about 10 or so hours of review, probably at a minimum. And I think a $500 one-time technical fee doesn't sound very, I don't think it sounds very out of the ordinary. And then we could decide whether or not we also want to assess an annual fee for a waste disposal facility. Some towns do, some towns don't. They will be every year sending those similar kinds of packets that we'll have to review. So I think that while, $500 for an initial technical fee might be a decent fee, I think something like $250 a year for an annual permit probably wouldn't be a bad, I don't think it would hurt anybody on their end. I think, just because of what they do. But I think it would be a good amount fee for it. And maybe we could just, because of the technical fee, we could say the first year we'd waive the fee. They'd apply, but waive the fee, that sort of thing.
Tammy, I have a question, or Tom. What do our abutting towns do? Like Wilbraham, Longmeadow, Hamden, do they have something similar? Just so we can kind of reflect closely what they're doing, just so we can make sure we're not off base?
Everybody does something completely different, is how I'm finding out.
Okay.
There are
Cool.
towns where, I've talked to everybody in Hampden County at a minimum, and then actually some people in the Hampshire County. Some people get very, very into the process, kind of similar technical fees. Some people get very into also the annual permitting. Chicopee is, I think there's the highest at $500 a year for their annual permit for the facility over there. Some people just say, let the DEP do it, and that's it. I think mostly it's because they don't probably have staff to review things like that. So there's a lot ranging everywhere I go. I think the closest that I've seen recently was Wilbraham, but I haven't been able to find out if they do an annual permit. But they've been the most recent in our county to go through the site assignment process. I think that just keeping a reasonable fee isn't a bad idea, especially if we're going to be getting the paperwork and we're going to review it every year as long as they exist. I don't think that's a hard ask. So I think what I was thinking was, so we could do just like our regular vote to approve it and send it to town council, but I think I'd like to add it to our waste regulations so that we have it in there, and then maybe I might put some language as to what an annual permit looks like. And then because of that, we'd have to do the public hearing. Even though the final adding it to the bylaws will also be on the town council side, kind of like how we did it the last time with some of the other ones. But I think it just would be good to put it in there and kind of put some guidance for what the document looks like, since it's not kind of set in stone, like say for our food service or body art, where they actually tell you what they want to see in a permit. So I want to kind of move that forward quickly so that maybe we can next month make that our month where we have the public hearing. I don't know if we want to do like 2 public hearings in 1 month, because this, if we move on to the next thing after the waste disposal site fee, to the tobacco, that might also require a public hearing. So maybe 1 month one thing, 1 month the next. I don't know if I want to bombard. Oh, also, because we're going to have a public hearing at some point, the technical fee kind of is if you look in the 310 CMR 16, it kind of is like you can separate those 2 things out too. You could separate a like public hearing fee plus the technical fee. I don't really think that's necessary. We do a little bit of budgeting for having a couple public hearings a year. So I think just keeping it at 1 technical fee and then calling it a day is not a bad idea.
We need to have the 30-day period, right, for public hearing?
14, I believe. Is it 4?
No, it says in here that up to 30 days from the date of the public notice.
That's the public notice that they're gonna have for their
Oh, gotcha. Okay.
Yeah. So they're gonna have a separate public hearing that's not it's not our Board of Health public hearing. But that one is also going to be for that's not so that's in relation, it's not that what I'm suggesting for next month really has nothing to do with this particular facility. It's in addition to our current codes. So if another facility came in, we would do the same thing, go through the same process with them. But yeah, when you start reading this, it gets really, really bogged down. And I was very happy that that our DEP rep just kind of slowly kind of ticked off step by step what it would look like. Because yeah, looking in this, it's very public hearing there, public notice there. So I'm kind of glad we've got that down, because Tom, when you first brought it up to me, I'm like, I don't even know where to start. And while I picked so many people's brains, everybody kind of had a different view of it, that I'm like, this isn't, it's not working. But we'll have that down. I think it'll be great. I know that Liz will love to get her hands on any type of recycling facility in town, because I know, we get calls all the time from contractors and whatnot. And I think that'll be great. And she even saw that there was a class on, it was like something about training for inspections on that. I'm like, well, I guess I'm getting her excited for some new stuff too. So anyway, so I just kind of wanted this. Oh,
Does
sorry.
this have any impact if we, like, with any of this disposal site, like with the transfer station?
Well, there are certain things that, kind of wouldn't affect the health department, but there's ways that, say, the town could negotiate with them to say maybe getting a better tipping fee for, say like, oh, maybe for the first 5 years, our, construction, whatever debris. But that would be, since that's not one of the things that we pay for out of our budget, that would be completely DPW related. But, having a facility like that in town would be good, because they're, the recycling, I was told, like the wood recycling had shut down for a little bit, the facility that they had been using. So I don't know, I don't really know how they treat that material when there's nothing close by. So it would be good to have access to that if we kind of negotiate it.
Yeah, the wood dumpster more often than not is trash, unfortunately.
Well, I think that it's hard to really monitor what people are putting in it, especially like if you just spend 3 hours at the transfer station one day a year, like I do, and that's it. Like when we do Earth Day, Yeah, it is kind of hard to monitor who comes in and what goes in there. So, but that's residential, I guess. But I'm sure there are plenty of people who live in town who have businesses that probably utilize it. But that's another issue. So that was, I just wanted to kind of give this sort of kind of pre-discussion. So my next steps are I want to write up um kind of some draft language for our current waste regulation. Maybe make a little quick draft application for like the annual. I don't know about if it's necessary to do one for the initial site assignment. Nobody that I talked to had a application for that type of fee. It was just something that, you know, you submit in the paperwork with it, but I will continue to keep looking into that. And then hopefully we can get a good timeline, and then we can put that in the paper, and then at our next meeting can do an official vote on it. So that's that. Any questions? Yay. I know that was like 5 full days of me trying to figure out exactly what we were supposed to do. So
This is why we charge fees for your time.
yeah,
This is
I know.
exactly what we do.
But it was explained in a 10-minute span, and I'm happy with that. Exactly. That's why we put the fees. And you know, I think that the changes that we've made over the last year to our fee structure, I think that they are reasonable and they promote business in town while still covering the amount of work that we do. And that's kind of, I think, all that we can kind of hope for out of our program. So if we're done with waste disposal, we can start talking about the sample regulation that I finally received just a few days ago. I was waiting to make the agenda, and then finally they sent us the newest sample regulations. So you guys want to go over it, or what do you feel like doing today?
Yeah, if you want to talk us through some of the changes, to, you know, I know it wasn't that long ago that we went through the sales, I mean, it says 2022, so, you know, it feels like it wasn't that long ago, but we've been talking about tobacco nonstop. So,
I
if you want
know.
to talk us through some of the changes since the last time we did a tobacco regulation, that would be great, Tammy.
I'm going to let's see. Okay, I think I'm going to skip ahead to the thing that might be the most interesting to us, is that there is a definition for a bona fide purchaser for value in here. And they are someone who exchanges value for a property without any reason to expect irregularities in the transaction. I don't really love that. I don't love that definition, but it's better than no definition, especially in what we dealt with Zane's and, you know, Ollie purchasing it. And so just to let everybody know, we do not currently have any open permits here. The one that we thought was open, which was the Pride one, was relinquished. So now there is no additional. So Ollie cannot apply for a permit in town. We can decide to do, this is totally out of line with like looking from the first page to continuing in. But I think some of the more important things, we can decide to do a wait list. That's an option we can add into here. I don't know how I feel about that. I talked a while to Sarah McColgan, who's come to the meetings, and I've heard Cheryl Sabara talk, and sometimes I feel like they're really pro tobacco business, and I'm not really sure why I get that sense from what they talk about. And you know, they don't super love the reducing cap like we have. And I guess maybe there's just a lot of strong lobbying out maybe near Boston, but I don't know. I like this idea. You lose your license, there's no license left. It's just, that's it. And I mean, you know,
as a medical professional, I'd love it if people had less access to cigarettes. I hate to say that.
I mean, I would love it if there was like, I don't know. I know we've made this joke before. I like Cumberland Farms coffee, okay? I mean, would I like there to be one in town? Yeah. Is there a license open for them if they wanted to sell tobacco? No, there's not. I guess, I mean, so if we were to say, oh, we have a wait list, that technically wouldn't be a reducing cap because that would be saying that, oh, I'm selling my business and you know, you can buy my permit. But the way we're doing it is if you go out of business or you don't transfer, your permit goes away.
Right, but if Cumberland Farms came in and bought one of the Pride stations, the way we have it written is that they could transfer the permit with the sale. So we could, like, it's not that the business, right? Like, it's not.
Yeah.
I'm accurate in that, correct?
It would have to be they're buying the actual facility. Like, so that they couldn't say buy a building across the street and take, you know, someone's license, basically.
And we have 19 currently, right, Tammy?
13.
13.
13. Yeah, 13. Yeah, so I kind of don't like the idea of the waiting list for that simple fact is that we really wouldn't be utilizing the reducing cap. Let's see.
What do other towns do again also? Just so like, I think it's nice to know if we're comparable to other cities, just from like a business attraction standpoint.
The towns that are in our the Pioneer Valley Tobacco Control District, for the most part, behave very similarly to us. They have, you know, the 36-month tolling period. They keep most of the same finding structure. Some of the towns like to do like the dual finding, so like doing a local fine for the same as the state. But I think it's just easier that we have the, you know, we have our 1,000, 5,000, wait, 1,000, 5,000, 7,000. What's our finding structure? I mean, I don't think there's anything wrong with our finding structure. We could, if we wanted to add, like, say, a local fee on top of that, we could, but it just seems easier to be like, the state law says it's $1,000 for the first fine. That's it. It's $5,000 for the second fine. That's it. 7,000. That's it. Let's see. The other things that, so if you look, I've got a copy of like our 2022 and our 2024 and the things that we didn't end up voting on in 2022. I still don't know if we need to change some of them, like the no new permits within so many feet of an existing permittee. I don't think we need to change that because we're not getting new permits. So why add that to it? The way that if you go down to 14, the way that the finding structure the way that it's not different than what we have, but they're using different language. They're calling one the separate state and local, and that's what we have. And then there's the unified finding structure. It's not really different language. It's kind of a little different ordering in how they put it in the paper and put it in words, basically. I mean, I think I like our suspension periods. I don't know if you guys, I think they're good. I think the 3-day, 7-day, 30-day, I think that's, boy, did we use them so fast this summer. That was fun. I didn't even think we'd ever get more than a first time violation. I cannot believe we had 3 in so many short month period. Okay. The thing that's different,
we had a lot of meetings.
Oh, it was so nice to like not talk about it for only one meeting, right? I think our February meeting was like the only one where we didn't talk about tobacco.
And honestly, like,
I'm bringing it up again.
As a business though, like those fines and those suspensions are totally avoidable.
They're very avoidable. Agreed. The version of the sample code that Sarah from MHOA gave us has some like coloring in it where yellow just means that it's copied from the latest version of the state laws, and green are like decisions that are unique to us. Um, I don't think there's too many changes in here.
And last time we did this, again, was this 1 or 2 years ago now? It was
Yeah,
really,
the end of 2022.
it was really helpful when, I'm blanking on her name, from the tobacco agency for the state, came and made
Yeah.
suggestions of things that we were missing that we should consider adding. Did she make any recommendations for next time as well too?
She didn't, but that's the other thing I was gonna ask. If, I mean, this doesn't have to be something that we do like right away. Maybe next month we can talk about the waste stuff. Then the next meeting we could say have her come in and take a look. Because even with Alex being part of the tobacco coalition, she hasn't. This was all new to her too. So Pioneer Valley didn't even receive these sample regulations yet. So, and Alex is on vacation, and she's our tobacco queen. But there's like a couple, I think there's some definition changes that are kind of, I don't know, they're kind of interesting. Oh, there was something on the list, on the checklist. Where is it? Oh, sorry. Okay. Oh, number 8, oral nicotine pouches. That's basically something that if we decide we're going to ban it, we are going to get lobbyists coming. So a lot of towns in the coalition are choosing not to ban the nicotine pouches.
What is an oral nicotine pouch?
It's like a tiny pouch of.
Is it like a lipper? I don't even know what to call those. They're like
Zin.
like,
Do you know,
Zin-
Tom?
Zin's the big one.
oh, okay. I'm imagining something like squishy and liquid, but it's like okay, I know what it is.
It's like
Yeah.
chewing tobacco, but not tobacco.
yeah.
And yeah,
It's
Put
the
in there.
tobacco pouch without tobacco.
yeah, still
Gotcha.
nicotine, but not tobacco.
Right.
I think
Gotcha.
that if we continue to keep our tobacco compliance program as strong as it is, we don't need to ban the oral nicotine pouches. But we can probably have Sarah come and talk about that. She gives a great presentation on products, which I know this isn't the place for it, but I've seen her do it a couple times. And it's kind of interesting to hear about. There's so many different things out there. It just, and with the flavors, which we have the ban on flavors, it's hard sometimes to distinguish when you're looking at a product to know, like, it might not have a name, but it might just say like red something, but really it's like strawberry flavored, which that's actually one of the definitions that they added in here, was distinguishable for flavors. It's perceivable by either the sense of smell or taste, because sometimes a product might not have something added into it for a taste, which we would call a flavor. But it might be there for the sense of smell, which, they're sort of interchangeable. So, that's a flavored product, basically. I like that they kind of added a little bit of that in there. They changed, let's see, I think they changed up rolling paper to add in stuff with like flavor enhancers. Yeah, adding the definition will permit banning flavored non-tobacco, non-nicotine wraps, such as hemp wraps. Let's see, not a lot. There's not a ton of stuff in here, but I like how they changed a little bit of the wording for how we do the reducing cap. They changed a little bit of wording about retail density. It's not a lot, but I think it clears it up. Let's see. And
Well, that sounds
Well-
like a great idea then, to have Sarah or whoever come back.
oh, and
talk us
you know why we should clean it up is that when we found out, I cannot believe we all read the last version and there was those 4 lines that were copied and none of us got it. So we can delete those 4. There's 4 in one of the last sections under violations in our version, it was just the same 4 lines had been copied and like all of us read it and just we put it in there. So it would be nice to delete those out of it. Not they just say the exact same thing over again. Anyway, so that's the sample. I think that what helped me a little bit was I kind of took the sample side by side with our old regulation and went down. I mean, it's the same. It's, because this is the product, the a la carte product that MHP and MHOA make us. It's kind of the same as the 2022, but just a couple, I think, tweaks, especially with where we're finding all the issues with flavor stuff. And I mean, maybe they added the bona fide for value because of us. I'd like to think. I know Westfield had some similar issues too. So anyway, so that's that. I think that, we don't have to move fast on it. I just think it's probably good to like look over it, see if there's anything that maybe we were hung up on more the last time. I have a weird glare coming in. It's better than it being dark. I feel like the last time we had this meeting, it was dark at this time. So, it kind of gives us some time to like look over if we feel like it. And then we can maybe so this is April. So May, we do waste disposal. June, we can talk to Sarah. We can decide if there's such a thing as a July meeting. Feels like a fall thing to do, approving some tobacco regulations, right? The air is crisp. Let's make sure it's clean. Anyway.
Well, I think it'd be a good opportunity for all of us to go through the regulations again, having the experience that we've had. I think we went through that last revision in 2022 and we're just like, okay, like this is the recommendations. And now reading it with the eyes of what we've had to work through over the last year, I think will be really important for all 3 of us to be able to look at the regulations and say, is this going to be helpful? Like, what if we're faced with these situations again? How does this help us or make our lives harder, right? And make the community better.
I don't think any active board had to deal with how quickly we had to make decisions over the summer months. With Zanes, we had Zanes, we had, what was it? C-Mart also had a violation, but they didn't contest it, so we didn't have to have the board hearing for it. But like, I can't, it was so strange how quickly, I thought like I learned a lot with like the first violation. I didn't think we'd have to like move on to having a second violation and then a third, and then an additional violation from somebody who bought the business. And which was a 4th violation, basically. So I feel like we wrote those things into our regs, but really truly understanding the meaning of them didn't happen until we actually had to work through it. So fun times. But I can start talking to I don't know if I feel like maybe they're transitioning Lisa into the role. And then there was somebody else's name. So there might be somebody else. I don't know. It seems like Sarah, I'm not sure if she's retiring or whatnot. So there might be somebody else that will be able to come talk to us about that. If anything, if they're not available, maybe we can get somebody from the Pioneer Valley Tobacco Coalition, like Meredith or Donna, to come talk to us, which is kind of nice. So how are we on this topic? Any more questions? Okay, let's see. We want to move on to the recycling and trash program updates, which I thought would be much more fun until I found out that we weren't able to get our Earth Day trash weighed yet. it wasn't picked up. I don't think it. So apparently the containers were blocked in over at the transfer station, and the people at Casella couldn't pick them up. And they were just moved today, so we won't get the weigh-in for Earth Day. Probably for another week or so. So I'm a little bummed about that. I was kind of excited to be able to do the tally, but I think we had record number of people sign up. Over 150 people signed up, and we had tons of prizes, and we're still trying to get people to come pick them up. Tom's like, yeah, I know. He's like, I'm gonna start eating some of these.
They're gonna wind up in the manager's office soon enough.
They look really nice. I mean, we've had Browns, the Nest, Shelburne Falls. We even had one of the tattoo places, but it can only go to the gift certificate can only go to an adult. Obviously, it's not going to the Boy Scouts. So that was kind of really nice that we had that. We were trying to see if we could get a sponsor to donate maybe some. So the money doesn't come to the health department. There is a special fund that's through that gets through Park and Rec. Like, I'm not exactly sure what kind of fund, but so we were hoping that maybe we could get some donators to sponsor some recycling bins for Pine Knoll. So that might be something we work on a little more aggressively next year. And then, we could put like their names or something on the side, but that'll be like a next year thing. While we love the gifts, it is like this every year we have like a whole stack of them in the office, and it's hard to get rid of. Let's see. Other trash and recycling, not too much. I feel like that's been kind of keeping Liz's time up quite a bit. Health department updates. So January 1st, March 1st, and May 1st are all they're all our like renew dates for a variety of different permits. Obviously, January 1st and March 1st have gone by. We are very good. I think everybody whose permits ran up in January have paid, have applied. Almost everybody that was up on March 1st, everybody has applied. We're just trying to get some stragglers pay their fee because of the way the online structure is. They can apply. Then we review. After we approve it, then we pay the fee. Unless the collector's office doesn't allow us to move forward because they owe back taxes or they owe some other fee in town. But I've been working with the collector's office so that if we have some businesses that have exorbitant fees, like honestly, most of our long-term care facilities seem for some reason to owe a lot in either taxes, water bills, or whatnot. Basically, we're kind of leaning on each other. Health department sending out a letter stating you have to have a permit. Unfortunately, your permit's going to be taken away from you. But I can't give you one unless you have a plan in place to pay these bills. So at least to get, even if you can't pay the bill, at least to start the plan, and that becomes a contract with the collector's office. So we've been working together on that. May 1st is like our next round of applications. And you typically, most of the things that we do there are body art, and almost everybody's paid up already, which is nice. And then we have camp season, which I finally went live last week, the week before with our new camp, our new online camp permit, which I had to hold off of because, of course, the state community sanitation program loves to wait a month before people start submitting permits to send out an entirely new rec camp code that they haven't done since 2018. So I kind of had 1 week to read the code, understand the code, redo what I thought was a beautiful online permit. Tell everybody, hold back, don't apply yet. But we got it out, and we're starting to get some camps applying. We've got, I think, 2 new camps coming in town this year, which is really good. We have Chris Buffington, our nurse, which would be great because would be so nice to actually have a nurse to review all the medical procedures and review camper medical forms. which I've had training for and I do myself, but I just like the idea of having that backup of having a medical professional to be able to look at them. There are not a lot of changes. There's some interesting changes where now they have to have an infectious disease policy. I can't understand why they didn't make this change like, 3 years ago with COVID. But it's better late than never, right? So we've got that going on. With the whole renewal season, we had talked to a lot of businesses who their food safety manager certifications were up. And with that, we decided to reach out to a company that offers it. And we're going to be having a training here in town on May 8th for food safety managers. We were also suggesting a lot of the camps send extra people because there's some camps that feed the kids, and having one person on staff really wasn't, it doesn't cut it. So that will be May 8th. If anybody knows anybody, their personal life, their organizations who'd like to send anybody, just send them my way. We'll send them the registration. They're offering it for a reduced price. Usually it runs about $210, $225, and her name is Kim McCarthy. She's offering it for $170, which I've never been to a place in my entire career where they offered it for $170. So we've got that going on. And then Chris was kind of joking. She just got back from vacation, so I wasn't expecting her to come to the meeting tonight because I thought that would be an awful boss. But we're calling this section "From the Desk of the Town Health Nurse." So Chris has been, as we've already established, she's part-time health department, part-time council on aging. But she's been doing some things over at the council on aging that she's offering to people of any age. So I kind of think that's a nice way to do it. So let's see, on the last Monday of every month, she offers blood pressure checks at the council on aging, and anyone is welcome to come and get the blood pressure checks. You don't need to be a senior. She's also going to be starting a Thursday morning walk on the rail trail. Let's see, at 10 a.m. starting May 2nd, and anyone of any age can come to that. She's also met with with the whole reorganizing over at DPH and with training and whatnot, we now have a new chief local public health nurse at the Office of Local and Regional Health, and her name is Caitlin Pettengill, and she kind of came in and she reviewed a lot of the stuff that Chris has been doing and her procedures, and we are now completely on track with all of our state deliverables for public health when it comes to public health nursing, which is fantastic after a year and a half or so of not having a public health nurse. And I'm really glad that she's been able to hook up with the local chapter of the Massachusetts Association for Public Health Nurses. I think they have meetings like once a month in Ludlow too. So at least, she can have that kind of camaraderie and kind of learning how things change constantly. And so more of that to come. Maybe we'll get her at our next meeting. Let's see. Mosquito season is upon us. We did not have a great winter. And so we actually had, last week was our first catch basin treatment, the BTI treatments, and those are all currently we're doing them at the parks and the schools. And this year we're adding to the contract, we've added a third treatment in September. Typically we just do 2, but last year because we had West Nile virus samples, we had Triple E samples, let's just add another one into there. And then I want to work heavily with the state entomologist and see if we can start identifying other areas outside of the schools and the parks that we might want to hit based off of any of the test results he gets. But
I can give you my street address. Just kidding.
Did we catch it? It's not made public. I was like, did we catch any positive mosquitoes in your neighborhood?
I hope to God not. I also spray DEET like a crazy person on my entire family.
Yeah, we're not allowed to release the locations of the testing areas.
I think I'm getting treated.
Yeah, but just say that if we say that there is a positive mosquito sample, it's gonna be in a decently urban neighborhood. That's just how it's gonna be, because West Nile virus mosquitoes love the catch basins. They love the junk in our backyards. The Triple E mosquitoes will probably find more in like swampier, wetland areas in town. So that being said, it's spring. Get out there, tip over everything that, was collecting junk and water over the winter. Cleaning up extra, yard debris, whatnot. There's also, we're not even addressing Lyme yet. A lot of fun little creatures out there that just love to give us diseases. So we'll, as things will go, we'll find out how this year will fare to others. There wasn't a lot of, luckily there wasn't a lot of human spread last year, but they're thinking that this might be a bad Triple E year. Knock on wood. Hopefully we won't have to deal with that. Let's see. And I think it was in March. We can talk about COVID. No, it's not really COVID. In March, the CDC put out the respiratory illness guidance, and I feel like it's so it's covering COVID, flu, and other respiratory viruses. I feel like it's more like the common sense approach to how we treat it and how we've treated viruses in the past. Let's see, one of my notes. I feel like I get all of the PowerPoints from the state start the exact same way. They look this blue page. Hold on. So I'll give the quick spiel for everybody. If you have symptoms of a respiratory virus, stay home, test if you have tests, mask around others, utilizing hand hygiene, respiratory hygiene, and cleaning. And then making sure that you are fever-free for 24 hours before resuming normal activities. And then also,
Without medication.
Fever-free without medication. And then they talk about, if you can wear a mask for those first 5 days. So if you don't have symptoms and you test positive, at least for 5 days, avoid crowded areas, utilizing good hand hygiene, and avoiding others at risk. And then you can choose to stay home for the first 72 hours. This is a recommendation, but it's not actually in the CDC guidance. So that's a little bit different than what the CDC put out. If you go home, if you develop symptoms, you basically revert back to the first thing we said about staying home. Let's see, if you were exposed to a virus, having normal activities as long as you're asymptomatic, continuing good hand hygiene, monitoring symptoms, considering masking, but it's not required. And then if you develop symptoms, go back to step number 1. And then there's some talk, keeping in mind being around groups of people who are at high risk, keeping in mind if you're high risk, do you want to spread this to people? Some of the guidance that's a little simplified are says school guidance. They're not requiring, or they're not asking children to mask if they're under the age of 2. There's some healthcare setting guidance, obviously a little different than what we'd see kind of at the just the public level. And the state has made some changes, they've added some clarification in language to healthcare guidance over what the CDC has. But it seems like regardless of that, like any healthcare center makes up their own or adds on to their own protocols. I feel like we've heard a lot of different things coming from the different hospitals over the last couple months. Katie, if you'd like to weigh in.
Oh, yes. All of the things.
All the things.
I think it's just really the idea of, obviously I still mask when I see patients, mainly because I want to protect them from getting whatever I potentially have and don't want to give to them. And realistically speaking, If it's a stomach virus, wash your hands with soap and water. You know, obviously sanitizer is great, but just thinking about that part of it, you know, and really that the norovirus ripped through the Northeast. I mean, that stomach bug, when it came through, it was multiple classrooms. Like I heard about at the middle school, they were like, we're all cleaning the classroom down today because there's so many people who've been sick. So I think really we got into really good practices during COVID about cleaning everything. And now we're kind of like, we're getting a little lazy again. So we're seeing a lot of viruses again, which is what it was like before COVID. And I really just try to encourage people, if you are sick, just stay home. Like, I don't want you to come to work sick and just tough it out. No, please don't do that. And the same, like when I was talking about the medication part, like someone's like, well, I took a Tylenol and I don't have a fever anymore. I'm like, that is still a fever. So just really being like, if you are sick, just stay home. Most of us can work remotely, unless you are someone like me who has to go take care of patients. But I think if you have the option to work remote and you're not that sick, but you're still sick, stay home until you're feeling better. And we want everyone to feel better. You know, I don't want people to feel yucky. So I'd rather that just be the case too. But all of the protocols are different across, like you said, like what the restrictions are. So just ask your employer about what they want. Again, Bay State is very different than even other places in the area about what we have to do if one of us tests positive for COVID or flu or things like that. So
Yeah, we've always kind of took it as sort of case by case, kind of depending on, you know, one of my employees in my office can easily hang out alone at their desk away from people if they've been exposed or whatnot. But, you know, it might be different if, say, you work at the senior center. You know, we kind of have to think about different ways, you know, and be thoughtful of who our customers are, who are the people around us. So we've always kind of, I think since I've been here, it's always been case by case, and we laugh because depending on what department or what person's talking to me, it always feels like it's a different incidence when it's a different person. It doesn't it's no two cases of I came across somebody with COVID are alike, and no two cases of I have a COVID are alike, and it's like snowflakes. But it's nice, and we have a very good thoughtful group of people who work in town, and I'm glad that, you know, we kind of rely on each other, and they always check in with me. And even though I know they know, and you know, I feel like especially the senior center, like if anybody knows the rules, I know they do, but they'll still call just to check to make sure that, you know, what are our protocols or whatnot now. So but that being said, we've ran out of our last shipment of COVID tests. I put in a request and it wasn't fulfilled. I put in a notification. I sent in a notification to ask, you know, will it be filled in the future? And they haven't responded. I'm guessing that they probably ran out of the state supply of COVID tests. So hopefully, you know, people, their supplies they have haven't run out. And I know that there was a round of tests you could get in the mail. If not, I know they are available at pharmacies, but hopefully they'll be able to fill it in for our next respiratory virus season, which I'm hoping that COVID isn't a summer thing again. Not my favorite time of year to deal with it. But that is everything I've got. Yes, on health department updates. Wasn't much. Questions, fun things. Anything else we'd like to see in the next couple of months?
Now I think we've got a couple busy months.
Yeah, some good stuff to like work on.
Yeah, we'll do the public hearing on the waste disposal site permit and the associated fees, and then dive into the updated tobacco regulations, and then whatever else comes our way.
Knock on wood.
Yeah.
No more no more decisions where it's 1 month after another month after another month. Like projects, fun projects to work on would be great.
Tom, anything you would like to see? Anything we can do for you?
I think he froze. Oh no. as both a resident and somebody who works in the town, anything that you'd like to see to enhance your public health?
No, I'm feeling pretty healthy right now. Thank you.
You want me to start bringing in some healthy snacks?
No,
Everyone's like, no. Rice
like I
Krispies.
said, I think we are certainly in good shape with obviously our staff in the building in town hall and our board. I don't think I don't think there's too much I worry about from a health standpoint as a resident or the manager. So again, I appreciate you all.
So should we book our May meeting then? Also, baseball is life. So I have so many like juggle. Tom knows this too, because my husband and him both coach in the town baseball. That is insanity right now. So it's going to be like Tetris, finding a night that there is not a baseball game or something else. I'm sure everyone else is juggling all the things in May.
I think that oh boy. Honestly, doing something before May 30th is gonna be rough. Mostly with like having, creating some of the information and, putting out 2 Thursdays or 2 weeks in advance. In my head, I'm just thinking of Thursdays. I don't know why. Oh, because the paper comes out on Thursday.
Mm.
This might be more of like a, and
That is
Renee
the
is
end. I
okay.
mean, it could be early June. It doesn't have to be May if we need the time, particularly to have a draft and have the post for the meeting. I mean, I would recommend, at least on my end, I'd recommend the first half of June. The kids are out on the 14th, and I think after that, it's going to get real tight in terms of people just being around.
Agreed.
I'm at a national conference June 7th through the 12th. So I could do like the first half of the first week of June. So I could either do the 3rd. I could do the 3rd.
I was looking at our practice schedule, so the 3rd is good. We get practice Wednesdays and Thursdays.
And
I'm
we
okay.
have it Tuesdays, so yeah, but that
Rebecca, what
works.
about you?
Yeah, I'm fine. The 3rd works.
I'll have to put like a big memo in my calendar to make sure that our like the regular posting is actually posted ahead of time. Okay, so we'll go for June 3rd.
Mhm.
6
Yep.
o'clock.
6.
Sounds good. All right. Before we leave, we need a motion to close the meeting, I believe.
I'll
And I
motion.
can- oh, okay, Rebecca's gonna motion to close the meeting. I can second
I
the
second.
motion.
Oh, go ahead.
That's okay. I already had it unmuted. So, Christine Johnston, aye. Dr. Katie Jobbins,
Aye.
Rebecca Torsha.
Aye.
All right. Thanks all.
Bye, everybody.
Bye.
Thank you.
See you tomorrow,
Thanks,
Tom.
Tom.
Thanks. Yep. Good night.